Good afternoon, teacher. My name is Laila Maya. My topic is about congenital diaphragmatic hernia. Definition: congenital diaphragm hernia is a birth defect that occurs when the muscle carrying a diaphragm does not form completely and a hole remains.
A congenital diaphragmatic hernia is a birth defect in which an abnormal opening in a baby's diaphragm allows abdominal organs to move into the chest. The diaphragm is a large dome-shaped sheet of muscle that separates the chest from the abdomen. When the baby breathes in, the diaphragm and outer rib muscles contract, expanding the chest cavity. This expansion lowers the air pressure inside the chest, creating a pressure change that causes
Application: urine stabilization to reverse hypoxia, hypercarbia, and metabolic acidosis.
And inhibit lung growth. This can cause breathing problems after birth. Let's take a closer look at the hernia. The chest is separated from the abdomen by a thin muscle called the diaphragm. Sometimes very early in fetal development, the diaphragm fails to completely form. This can cause some of the organs in the abdomen, such as
Pros: 1. Mechanical ventilation with oxygen can be given. 2. Herniation occurs late in fetal life.
Congenital diaphragmatic hernia is a condition that occurs in approximately 1 in every 2,500 births. The condition is usually diagnosed during pregnancy with an ultrasound scan at around 20 weeks. It happens when the diaphragm of the unborn baby, that's the muscle that divides the chest and abdomen that's essential for breathing, fails to develop properly, leaving a hole in the muscle. If the hole is large enough, the contents of the abdomen, such as the stomach, gut, and liver, can move up into the chest. The diaphragm is repaired after birth, but in severe cases, the presence of the organs in the chest cavity can compress the lungs, preventing them from growing properly while in the
Cons: 1. The fetus does not use lungs to breathe. 2. In some babies, the diaphragm hole is small.
After they're born, due to the cardiorespiratory instability and sometimes significant respiratory failure, they need a period of stabilization by conventional methods and sometimes utilizing
Isuet applied in Ecuador. Congenital diaphragmatic hernia represents 8% of congenital malformation with an incidence 1 per 2,000 and 5,000 births in Ecuador.
Off the ECMO circuit.
When the surgery is performed, we actually bring the whole team down to the neonatal intensive care unit.
Conclusion: the management of patients with congenital diaphragmatic hernia is multidisciplinary, and attention should be made to establish an early diagnosis from the prenatal period in order to optimize management and offer the best current therapeutic tools.